The moment I had the needle in my arm, I started crying. I'm even feeling emotional talking about it. And it wasn't because there was pain, but because there was relief.
Hello, everyone, and welcome to 3 Words, a bite-sized podcast about the significant and strategic choices that we can all make in order to become, yes, the best version of ourselves. My name is Dr. Michael Brown. I am the host of 3 Words, and I have the privilege, as I have often had the privilege, of not only raising this guest on 3 Words, but actually welcoming him, my oldest son, onto the set for yet another podcast conversation. Now, sometimes he's not quite the expert. I am, and he's just along for the ride. But today, the soon-to-be Dr. Justin Michael Brown, 4 months from now, he is the expert, and I'm going to follow along with him. So, Justin, our 3 words for today.
Thank you, Dad. And just to kind of a quick caveat, I'm not the expert. I'm not an infectious disease doctor. I very much submit to and defer to those individuals that really study this. But because of my medical education and is soon to be a family physician myself, my 3 words for today are get the vaccine.
I think this is a timely conversation. Do you not, viewers and listeners? Because obviously we are in the middle. Well, hopefully not the middle. Hopefully the second half of a global pandemic, COVID-19. Instruct us, teach us, give us some insight on those 3 words, Justin.
Sure.
Get the vaccine.
So I think the importance of this conversation needs to be set up by a conversation just about the coronavirus. COVID-19 has been incredibly destructive, not only in our country, but in our entire world. That at this point, at the time of this recording, over 100 million cases in the entire world. Over 2 million deaths in the whole world. And in our country alone, there have been 25 million cases and over 425,000 deaths. So yes, COVID is a big deal.
It's a real thing.
It's a real thing. It's a big deal. And you and I both and our family and for those that are listening to us today, all of us have been touched by COVID-19. At this point, some of us in varying degrees, and obviously with the virus, 80%, they do quite well. 15% have to go to the hospital. 5% are in the ICU, and 1.5%, 2% actually are dying from this. And for many of those that don't die, as our friend Dan Costello, who we had on a few months ago with a conversation about his own experience with COVID-19, continued persistent symptoms for quite a long deal of time. So this is a serious thing. It's a big problem. And it's been a hard year.
And it's not just for the elderly. In fact, as you know, as I work on campus at Bowling Green State University, there are 18, 19, 20-year-olds who are struggling profoundly after their diagnosis. One gentleman particularly who I talk to on a regular basis, he's had a migraine for over 100 days. And he is completely healthy, no pre-existing conditions. And obviously as well, we know people who have perished from this. And what I'm hearing is that 4,000 people a day are now dying in America.
That's where we're at the point of this recording.
4,000 people a day.
So Dad, let me tell you about my experience with getting the vaccine.
Okay.
I was so blessed as someone who's in the medical field and is pursuing my medical degree that I was in that kind of early phase 1A of the distribution period for the vaccine. And as I went to the Lucas County Health Department Recreation Center and I stood in line, I felt like I was beaming. I was so excited. The moment I had the needle in my arm, I started crying. I'm even feeling emotional talking about it. And it wasn't because there was pain, but because there was relief. I think it's been a hard year for many people. I myself have performed CPR on patients with COVID, not knowing how it was going to end up for them and for their families. And just the experience of getting this vaccine as quickly as it's come, it's an incredible blessing and a gift. And I felt so relieved.
Wow.
And additionally, so grateful for the healthcare providers that are on the front lines that have been protecting us up until this vaccine has come. And even now in the distribution period, that retired nurses and firefighters and everybody is getting a hand on this. There's, plans for the military to become involved in the distribution. This is a team effort, and I'm so grateful that because of scientists and researchers and volunteers and government agencies that we have come to this point where we can actually begin to turn the tides on this virus, and that we will see this chapter of this pandemic come to a close. And I have a lot of hope for the future because of this vaccine.
Well, and we've seen this in the past. And again, I'm not a doctor in this sense. I'm in higher education. My PhD is in higher education. Yours is obviously in the medical field. But haven't we been here before with other global pandemics where now we've eliminated, if not decreased significantly, major diseases across the world because of vaccinations?
Sure. And even specifically to talk about, there's kind of this idea of, well, why would I get a vaccine for polio? No one has polio anymore. Well, that's the reason no one has polio anymore, is because, or very few people have polio anymore, is because of the vaccine. Similarly, smallpox would go through entire countries, and through the world it was killing people. Yeah. And now, smallpox isn't really a thing in our world right now. And so too it could be in the future with COVID-19. So I'd love to answer a few kind of questions about the virus and specifically about the vaccine. The first question is it safe? I've heard a lot of conversations about, well, is this safe? It was developed very quickly. And while that definitely was the case, a lot of the speed of why this vaccine came so quickly is not because corners were cut, but because red tape was cut. Wow. The bureaucracy, the slowness of our medical systems, and the authorization experiences and the steps in those processes, the red tape was cut. The trials and the research that was done, there were no corners cut there. It was done exceptionally well. And in terms of safety, the majority of people are going to have very minor side effects, if any, from the COVID-19 vaccine, such as a sore arm. Maybe they'll feel a little bit tired, get a fever. And in regards to, if there's any really severe reactions that some people can have, indeed, but that's 1 in 100,000 is what we're seeing right now.
And what I'm hearing, correct me if I'm wrong, that happens oftentimes in the first 15 minutes.
Right.
When they can be nearby.
When they're watching you. Yes. That's a part of, for those who are listening and viewing, that when they get the vaccine, they will be required to stay put in the vaccine distribution site for 15 minutes.
Okay.
And that is so that if they have any sort of reaction, that they have medical providers right there that can respond to them. But yeah, so as far as a severe allergic reaction, only 1 in 100,000 people that happens to. So if we think about the 1% death rate of COVID-19, if we use 1% versus 0.001%, you are 1,000 times more likely to die of COVID if you get COVID than you are to have a severe reaction to the COVID-19 vaccine.
Interesting. We've not talked about this, but did you have a reaction? You had your first of 2 doses. What happened to you?
Yeah, I mean, for me, I felt some arm soreness, and that was my experience.
That was it?
That was it.
That was a small price to pay.
It was. I would, I've been saying I would, even if I had, less minor side effects in terms of, if I got a fever, if I got a headache, for me, I would rather take 2-3 days of being tired and have a fever than, for many people, 2 weeks, and for some people 2 months of symptoms and fatigue and just like, I just can't get going. So that's kind of short-term side effects. As far as long-term side effects, there's not a lot of data at this point, but my understanding of vaccines is that so rarely are there long-term side effects to any vaccine in general, just because of the way that vaccines work. So what they do is they basically give an injection of a part of a virus or a protein or an element in your body that your body naturally, if it got that virus, would respond to, so that the next time you would come into contact with that particular, we call it an antigen or that type of protein, that your body would respond more quickly. So there's really actually, it's a natural process of experiencing vaccination and building up this sort of immunity.
So this notion, Justin, that I'm just going to kind of not get the vaccine if someone says this,
Sure,
because I want to just fight it off naturally.
Right.
What I'm hearing you say is vaccination actually stimulates a natural response.
Right, exactly.
Okay.
It's a very similar thing to if you have chicken pox, your body's going to fight off the chicken pox. And the next time that your body comes into contact with chicken pox, it's going to fight it off so quickly that you don't even really develop the infection. So we've talked about the safety of COVID-19's vaccine, but I want to talk about how effective it is.
Okay.
And this vaccine is actually one of the most effective vaccines ever. At rates of 94, 95% effectiveness for both of the current authorized vaccines that we have in the United States. So, this is more effective than your flu vaccine. This is more effective than your measles vaccine. This is more effective than your chickenpox vaccine. And in fact, it's one of the most effective vaccines ever.
Why is that?
Why is that?
Yeah, I'm just curious.
So the type of research that they use and the kind of the mechanism of this vaccine being an mRNA virus kind of vaccine is what they actually do is instead of giving you any part of the virus, they're actually teaching your body to make a piece of the spike on the outside of the virus. So there's no virus being put into your body at all. And it's actually teaching you to fight one of the components of the virus by making that component yourself for that brief period of time.
If your mother was here, she would say, "You're welcome, son," because she gave you a fantastic IQ. Because that didn't come from dad. No, I appreciate you explaining that to me.
Yeah,
That's
and
fantastic.
it's so effective because of the fact they believe that it's because kind of this new science, which in one way is new because it's the first vaccine that's really being authorized to be used in this way. But these types of mRNA vaccines have been in research and in development for 10 years.
Okay.
So this is not a new thing and it's incredibly effective.
We're just implementing some decade-long research in a situation
Definitely.
that is happening now.
Yes.
Okay.
Absolutely. So I'm very encouraged about what I've read about, what I've seen about. I trust the science and I believe it. But I want to transition this conversation into why do we not trust science? Why as Americans, why as human beings do we struggle to trust in science? I think that there are several reasons.
Okay.
The first is I think science can be really confusing. The terminology, the amount of education required, even as I'm reading through the Pfizer and the Moderna vaccines studies and they're pages long and some of the statistics, I can't wrap my mind around. And I've been through a good deal of education to try to understand these things. So confusing terminology leads us to not trust science. I think additionally, in our world, we celebrate skepticism. That we think, if I'm not easily fooled, if I'm thinking critically, if I don't trust the government, I don't trust scientists, that it makes us somehow noble and it makes us somehow, not easily fooled and more critical thinking. I think additionally, we can be led by emotions over reality sometimes. I think additionally, we often have our minds made up that if we acknowledge science and if we trust in science, we might have to change our minds about things that
we don't like to change.
We know
Well, it requires humility.
It does.
Especially if I've been trumpeting a particular perspective, if I have been touting a certain idea, and then I have to say, I was wrong.
Right.
I think differently now. We tend to think that's weakness. And we've talked about this on previous podcasts, and we talk about this all the time in our father-son conversations. Changing and evolving and maturing is a good thing.
Yeah.
And we can think differently about things at 40 than we did at 4.
And I think too, that's another reason why we don't trust science is because recommendations change. And I think
I remember early on, they were saying, don't wear a mask, don't wear a face covering, don't do that.
Yes.
And so that I've been hearing from some of my friends, that's one of the reasons, they changed their minds on it. If they would have just said that from the beginning.
Yes.
So why did that happen?
Right. And it's because there was a shortage of masks. And I'm sure people have heard this conversation before that there were a shortage of masks for direct care providers. So the encouragement was, don't go buying up and stealing the masks out of in my doctor's office that we were at, we were like, where are all the masks? Because patients were taking them because they were so concerned.
Similarly, where's all the toilet paper? People were hoarding it.
Exactly. Yeah. So I think changing recommendations, that sometimes people can look at that and say, see, the scientists are lying to us. They don't know what they're doing. But in reality, we're actually, because the science and the evidence is getting stronger and more accurate and more focused, that's why recommendations change. And then I think the last reason that I really want to share today about why we distrust science is, I think, the legitimate one. And that is that there are concerning realities that historically, scientists have done wrong by people in our world. And I think in particular, to speak of the U.S. government experimenting on Black men with syphilis, forcing sterilization of Black women in our country, even present day inequities where a Black or brown patient is less likely to have a doctor talk to them about their diet or about exercise because the doctor thinks that it will be less worthwhile. I think additionally, when doctors have not communicated well with you in the past, when doctors have done an inadequate job explaining what's going on and leaving you confused, leaving you feel with your concerns discredited and disregarded, I think that there has been wrong done to people. And I think as a healthcare profession, as a medical system, we have to own that. But I would just encourage those that are listening, and for those of whom that is the case, where they don't trust science because of these concerning realities, I would just encourage them to please consider, to please take into account that even though you've been burned and hurt in the past by select individuals or even the system as a whole historically, that there is much benefit to following the science and to trusting in and to believing in science.
But don't we also hear, I appreciate your perspective on that, son, but don't we also hear conflicting scientific reports? This scientist says, and this scientist says,
right.
Thus, if I can use the term, conspiracy theories. How has conspiracy theories factored their way into this conversation about vaccines and COVID-19?
Yeah.
I have folks around me who are talking about these various theories.
Sure. And I guess I'm not as familiar with all the different conspiracy theories. I tend to try to really look at reputable sources, and be really investigating those. But if I could speak about this idea of conflicting evidence, that oftentimes science, when research studies are performed, we begin with information that is weak, evidence that is weak, and we progressively try to develop and to create studies that will give us stronger and stronger evidence. And I think at times there is really weak evidence out there that is trumpeted publicly by those that either don't quite understand that it's weak evidence, or maybe those that are intentionally trying to misinform for whatever reason that might be. So I think that most conspiracy theories, though not all of them, maybe are based on some weak piece of evidence somewhere.
Yeah.
I've even heard a lot of concern about the COVID-19 vaccine negatively impacting fertility for women. And if I could just speak to that,
please.
That the reason that I think this is spread around is because of the reality that pregnant women were excluded from the vaccine studies. So there is a lack of data to support that, we can't definitively and with strong confidence say that it is for sure safe for women who are pregnant or breastfeeding to be able to get the COVID-19 vaccine. But that doesn't mean that there's any evidence out there at all that would demonstrate that it's actually harmful. So when there's evidence or when there's conspiracy and ideas of, this is going to hurt my fertility, I'm not going to be able to have kids in the future, there's no evidence to support that won't happen. And there's no evidence to support that will happen. So I think that's where a lot of some of these conversations of conflicting evidence and conspiracy theories can develop, because even with the COVID-19 vaccine, we the scientists are not saying right now that they are confident that the COVID-19 vaccine reduces transmission of the virus, which is why we're encouraged to still wear our masks. And that's not because they have found that it doesn't reduce transmission, but that they haven't found that it does reduce transmission. And there is actually some really encouraging evidence that both of the two currently authorized vaccines do potentially reduce transmission, do potentially reduce asymptomatic as well as symptomatic infections, and even will potentially reduce the severity of infections if you do get them. But they're really, really cautious to say it does reduce transmission because, well, we're not just going to presume things. We're not going to say things. I even heard a physician on TV the other day say, when I don't know the answer to a question, I'm going to be really, really careful that I am not just going to make up an answer and I'm not just going to guess, but that I am actually going to follow the science.
So I'm hearing what I would sense is your recommendation. Are there other recommendations? Like, what would your recommendation be? I want to hear specifically.
Definitely.
To those who would say, Justin, should I get the vaccine?
Definitely. So my encouragement to those that are listening in and those that are watching our podcast today is here are a couple of vaccine best practices. Follow the science. Believe and trust and explore reputable sources. Talk to your doctor if you have any concerns or hesitancy, or if you have any questions or specific medical conditions that you might be wondering, should I get the vaccine? But all in all, my recommendation for the majority of individuals is that this vaccine is safe, it is effective, and it brings us hope and relief that we can get on the other side of this pandemic. So my encouragement to those listening today, get the vaccine.
For life coaching, consulting services, or to hire a keynote speaker, please visit dmbcoaching.com.